Hi, Deb.
Hello, Tammy.
We have Inge today in the back seat.
Have you met?
Pronounced that really good.
Right?
Oh, thank you. I can't pronounce your title, though, so why don't you introduce yourself, Inge?
So I'm a PPSMC, a palliative pain and symptom management consultant for the North Simcoe Muskoka Hospice Palliative Care Network.
Amazing.
Yeah, I know,
Yeah.
mouthful.
That is a mouthful.
And you've been doing this work for a while now, is that right?
Yeah, I started with them in January of 2013, so yeah. long time.
Over like a decade.
Yeah, it's going to be 12 years in a month.
Seen lots of changes, I'm sure, in the palliative approach to care.
Yes, and wonderful. Like if I'm thinking way back when, because of course I've been geared to palliative care for longer than those 11, 12 years. A lot of change has happened. Like
Where do you see the most changing?
The part where I really see a change is that people are not as afraid of palliative care, of the word palliative, especially not in healthcare providers. Perhaps the regular people out in community are not as comfortable with it yet, but for sure healthcare providers, it's way more known, and it's a specialty, right? It's not something that we just made up or do.
Palliative meaning no cure, right? It's a life-limiting. Okay, so help me understand.
So a palliative approach to care is what we do for a person that has a life-limiting or life-threatening illness.
Okay.
So that could be anything from diabetes, kidney disease, neurological diseases like MS, ALS, Huntington's, cancer diagnoses. And those cancer diagnoses can be sometimes cured or at least go in remission. So it doesn't mean that nothing can be done. It's a very active role that we play in what I always say, it's just making quality of life as good as we can make it wherever we are. I actually myself go a little bit a step further. We are born, we are going to die. Yeah. I want a palliative approach to care for myself.
Absolutely.
Today, tomorrow, next week, for however long I'm going to be here. So just to make quality of life as good as we can make it.
For sure. And I would say at Tompkins House, in any of the hospices, oftentimes the perception is you're coming in, palliative care means you're dying, or it's just cancers. You just named off a variety of different diseases, right? So that's really, really helpful. Inge, thank you very much.
You're welcome. And then don't forget the dementia disease.
We will. We're going to stay tuned for our next talk with you. Hang in there. We'll be right back with Driving Dialogues with Tammy and Debbie.
Thank you.